Welcome back, everyone. This is the NMed 1040 Medical Terminology course, and today's lecture is going to be on Chapter 4, which covers common prefixes. These are our learning objectives for today, and we'll get right into it. So what I want to do is go over some of the common prefixes that you're going to come across, and we'll discuss their meanings. I'll maybe give you a couple of medical terms that you may have heard or common terms that you will hear of that incorporate the prefix. And I encourage you as we go through the presentation to think of words yourself that you might have come across that are either medical or non-medical that help you remember what the prefix means. So the first two prefixes are a and an. These are very common. We see these all the time, and they mean no or not or without. So you can have a condition known as aphasia, which means unable or without speech. And this is a condition that can happen after a patient's had a stroke, right, where they're not able to talk. So they are aphasic. Another common one is apnea. You might have heard of sleep apnea. So apnea means not able to breathe. So the a means without, and then new, so which is PNEU, means either lung or breath. And so when we put the two together, apnea means without breath. The next two, ab and ad, are sort of related to each other. Ab means to pull something away from. So we use the term abductor muscles. They move the legs apart, right? And you probably are all familiar with the term abduct, right? Which is when you take a child away, right, from where they belong. The companion prefix is ad, which means toward or near. So the adductor muscles, which are on this side of the bone, they are responsible for bringing the leg back in. Sorry, this is kind of cut off a little. Maybe move that up to here, right? So when we abduct, we move the leg away. When we adduct, we bring the leg towards the midline. Ana is a prefix meaning up or apart. So the word analysis means separating a substance into its component parts, right? Lysis means to sort of tear away from, and ana means up or apart. So we're tearing it apart, which is what you do when you analyze something, right? Anti is a prefix that means before or forward. So antepartum means before birth. You're also probably familiar with the term anterior, right? Which is when we're looking at something from the front side. Don't mix up that anti with ANTI, which means against, right? So you probably can think of lots of words with anti in them. So anticoagulant stops blood from clotting. Bi means two or both, right? So bilateral, meaning pertaining to both sides. The term bicycle, right, has two wheels. So as we're going through, if you can think of common words that you already know the meanings to, then that could be helpful sometimes when you're trying to remember what the prefix means. Brady means slow. So we often say a patient has bradycardia, right, which means they have a very slow heart rate. Con is a common prefix meaning with or together. So you can have congenital, which means that there's an irregularity present at birth, or it comes together with the birth. Concurrent means two things happening at the same time. In other words, together, right? This diagram here just shows you an example of what we call bilateral hilar nodes, right? So nodes on both sides of the hilum, which is the center of the chest. Dia means complete or through, right? So you have the term diarrhea, right? Which is when you have the discharge of watery waste through the colon. Another word would be diagram, which means to mark out by writing or recording. So dia means complete, and gram or graph means the process of writing or recording. Diaphragm. So this is the diaphragm in your body. And dia means through or apart. Phragma means literally fence. And the diaphragm is a muscular partition that separates the chest from the abdominal cavities, right? So it goes through, right, or a complete separation of the two cavities. Dys means painful or bad or difficult or abnormal. So you can have dysplasia, which is the abnormality of the development or formation of cells, or you could have something like dysphagia, which is painful swallowing. Dystrophy, right, which is abnormal growth. So this is another very common prefix. Ek means out or outside. So think of an ectopic pregnancy, right, is a pregnancy that occurs outside of the womb. Instead of being in the womb, it occurs in the fallopian tube. Endo, this is a common one. Endo means within, right? Or in or inner. So when we talk about an endoscope, this is a flexible scope that allows us to see inside various structures. In this case, inside the esophagus, the stomach, and the intestines. Epi means above or upon. So the epidermis, which is your skin, right, is the thin outermost layer of the skin. X means out. So the term excision is the act of cutting out or removing or resecting. Extra means outside of. So when we say something is extra hepatic, it means it's outside the liver, right? Or extracranial means it's outside of the brain cavity. And you probably heard of the term extraterrestrial, right? So from outside of the earth or outside of this world. Hemi means half, right? So think about the hemisphere, right? So there's a northern and a southern hemisphere, right? So it's half of the world. Hemiplegia means paralysis on one side of the body. Hyper and hypo are common prefixes. Hyper means excessive or too much or above. So someone who is hyperthyroid has too much thyroid hormone. Hypo is the opposite, means deficient or too little or below. So someone who is hypothyroid doesn't produce enough thyroid hormone. Another word would be hyper versus hypoglycemia, right? So hyperglycemia, too much blood sugar or sugar in the blood. Hypoglycemia would be low blood sugar. In just means into or in. So when we talk about an incision, right, is when you make a cut into something. Inter means between, right? So if you think of intervertebral disc, right, that's the space in between the vertebrae. Intra means within. So intravenous means within the vein, right? We poke our needle inside the vein and we deliver our radioactive material within the vein. You can have intrahepatic, which is a lesion, say, that is inside the liver. And you can have intracranial if a lesion is inside the brain cavity. Mal is another common prefix, which means bad, right? So you can have malabsorption, right? Poor absorption, or you can have malignant, right? Which is a bad condition where a patient has cancer. Meta means change or beyond, right? So hence why, Facebook has renamed itself Meta, right? So Meta, in the case of the metacarpals here, the carpals are the wrist bones and the metacarpals are the bones that are beyond the wrist, right? You can also have metastasis, right? Which is when you have growth beyond the primary tumor, right? When cancer has spread, we say that it is metastasized, which means that it's been found beyond the borders of the primary tumor. Neo just means new, right? So if we have a neoplasm, this is new growth of tissue. Para means beside or near or along the side of, right? So the parathyroid glands are beside the thyroid gland. So the red is the thyroid gland and the parathyroid glands are embedded within the thyroid tissue, right? So they're right alongside the thyroid tissue. You can also have something like para-aortic lymph nodes, right? Which are beside the abdominal aorta. And don't get that mixed up with peri, right? So peri, P-E-R-I, remember, means surrounding, right? So think of periosteum, right? Which is the outer covering of the bone. The perimeter, right, is when we take a measurement around something. Periarticular would be another word where we're looking at something that is surrounding the joint cavity. Poly is a common prefix that hopefully you remember that it means many or much, right? So if you have something like polyuria, you have a large volume of urine when you pee. What else? Poly, I'm trying to think. I can't think now. Oh, polycystic kidneys, right? Where you have multiple cysts, many cysts within the kidneys. Polygon, right, is a geometric shape that has multiple sides. So that's poly. Post means after or behind, right? So if we have something like a post-mortem study or an autopsy, it's done after the patient has died, post-mortem, after death. Pre is the opposite. It means before. So if you have something that is precancerous, right, then this is growth before it's been able to turn into a cancer. Pro means before or forward. So prolapse, meaning pro means forward, lapse means slide. So prolapse means to slide forward. So this is a diagram that shows you mitral valve prolapse, right, where the valve balloons upwards as the ventricle contracts, right? So it's going the opposite direction, right? This is normal that the valve seals. In this case, this is going backwards up into the atrium, okay? So that's prolapse. Pros also means before or forward. A term that you may be familiar with is prosthesis, right? So the Greek word tiphani means to put, right? And pros means before. So a prosthesis is something that is put before, added on to the body. Prosthetic or prosthesis. Quadrate or quad means four, right? So quadriplegia means that they have paralysis of all four limbs. Re means back or behind, and so does retro, okay, meaning back or behind. So relapse would be, remember, lapse means slide, re means behind. So a relapse means to slide behind or to slide backwards. And in the clinical sense of the word relapse, if a patient relapses, it means their condition has gone backwards, right? So any progress that they've made, it's now gone backwards, back to the start. Retro is the term retroperitoneal, right? So in this diagram, the red lining is the peritoneum, right? And anything sort of in behind that line is known as retroperitoneal. So these are your two kidneys here in cross section, and the kidneys are retroperitoneal, right? So they're behind the peritoneum. Another term you might be familiar with is retrospective research study. So that means that it goes from the current time period going backwards in time to do the research, right? As opposed to a prospective study where you start from that particular date and you follow the patient going forward. Okay? So retrospective versus prospective. Sub is a fairly easy one, right? It means under or below, or sometimes less than. So if you have something that is subcostal, costal means rib, so that lesion would be below the rib or underneath the ribs. Common word, submarine, right? Sub meaning under, marine water, so submarine can go under the water. Syn means together or with. So the term syndrome, right, means that drome means running or occurring, and syn means with. So a syndrome is a group of signs or symptoms that occur together. And we'll talk a little bit more about types of syndromes in just a minute. Tachy means fast, right? So tachycardia or tachypnea, right? Breathing that is too fast. Trans just means across or through. So you can have something that is defined as transabdominal, right? Across the abdomen. Transurethral. Transverse slice through the body, right? Meaning it's cutting across or through the body. Tri means three. So this is an example of the tricuspid valve, heart valve. It's got three little leaflets. The other term would be triangle, right? A triangle has three sides. Ultra means beyond. So a common word is ultrasonic, right? So ultra means beyond, sonic means sound. So ultrasound is when we obtain images by the use of sound waves beyond the audible range. Uni means one. So if a lesion is unilateral, then it only affects one side. Right? If it's on both sides, then it's bilateral. Another term would be unicorn, right? Has one horn. Okay, so a couple of additional medical terms that incorporate those prefixes. First one would be the adrenal glands. So the adrenal glands are a pair of endocrine glands, and they're located above each kidney, right? So ad meaning next to, renal meaning kidney. So the adrenal glands sit on top of the kidney. Antibiotic, right, is something that destroys or inhibits the growth of microorganisms such as bacteria. An antigen is a foreign substance, right, such as bacteria or viruses that can be part of the immune reaction. We talked about bradycardia, so that's a slow heartbeat. And bradycardia is defined as a pulse of less than 60 beats per minute. And just a note that it's not always necessarily a sign of disease. Many top level athletes have very slow heart rates, right? Down at between 40 and 50. So it just describes the rate of the heartbeat. Congenital anomaly is another common phrase, and it refers to an irregularity within a structure or organ that an infant is born with. So if you can think of some examples of congenital anomalies, one would be the cleft palate, right? Things like clubfoot, certain heart defects, spina bifida, where their spinal cord doesn't develop properly, even Down syndrome, right? These are all congenital anomalies. There are some causes of non-hereditary congenital anomalies, so genetic defects or chromosomal disorders, environmental teratogens, nutrient deficiencies, infections, all of these can also cause non-hereditary congenital anomalies. The next one is dialysis. So dialysis is this machine that removes the harmful waste products from the body using an artificial machine known as a dialysis unit. Okay, so ectopic, we talked briefly about this already. This is an abnormal pregnancy when the embryo implants outside of the uterus, usually in the fallopian tubes, not tombs, tubes, but sometimes it can actually occur in an ovary or even in the abdominal cavity. We talked about the parathyroid glands already. We talked about prolapse, right, where the organ can fall or slide forward. So you can have a prolapse uterus, you can have a prolapse heart valve. We talked about retroperitoneal already. A little bit more about syndromes. Again, these are a group of signs or symptoms that commonly occur together, and they indicate a particular disease or abnormal condition. So some syndromes that you might be familiar with, AIDS, right, or HIV. The symptoms include severe infections, malignancies such as Kaposi sarcoma or lymphomas. Patients can have fever and malaise and GI disturbances. And we know that HIV now is caused by a virus that damages the lymphocytes, which are the white blood cells. And so when all of these symptoms occur together, That's known as acquired immunodeficiency syndrome, or AIDS. Other syndromes include Barlow syndrome, which is a mitral valve prolapse, where you can have abnormal sounds or murmurs that are heard in the chest when you listen through a stethoscope. And these murmurs indicate that the mitral valve is not closing properly. And so these patients can develop chest pain, dyspnea, which is difficulty breathing, and fatigue as some of the symptoms that together make up the syndrome known as Barlow syndrome. So I believe there's a little table in your MedTerm textbook that shows you some images or talks a little bit more about syndromes. So the term subcutaneous, cutaneous means referring to the skin. So subcutaneous would be below the skin. So there's different types of injections that are possible. So you can have intravenous, and you can have subcutaneous, you can have intramuscular. So these are all the different layers of tissues below the skin. So depending on the angle that you go in, you can hit various components, but all of these would be considered subcutaneous because it's going below the skin. Tachycardia is a condition of a fast, rapid heart beat. Anything over about 100 beats per minute is considered tachycardia. Transurethral just means when an instrument is passed through the urethra. And we've talked a little bit about ultrasonography or ultrasonic. This diagnostic technique, here you can see the outline of the baby, right? Using ultrasound waves that are beyond the audible range of sound. And we can do this and produce a photograph of an organ or tissue. Okay, so that's it. I'll leave you to, you guys can work through the medical scramble on your own and see if you can come up with the bonus term. Again, if you have any questions, send me an email or we can chat when I get back on Monday. You can also go ahead and do a couple of more exercises in chapter 4. I will not be putting up the quiz, I don't think. I think we'll do that in class. I have a couple of other PowerPoints that I'll do when we get back that will go over some of the confusing prefixes. Okay, so good luck, and I'll see you soon. Bye-bye.